Welcome to this session on the Mindful Body Scan. I thank you in advance for taking this time for self-care. Before we get started, I'd like to take a moment to thank the Florida Blue Foundation and the Florida Medical Malpractice Joint Underwriting Association for providing support for this presentation. This presentation is offered in service to PAMI's goal of advancing innovative pain education and patient care. This presentation is also offered in service to you. I hope this session is helpful in finding more ease in your daily life. Hi, my name is Kim Holton. I am a faculty member in the Department of Health Education and Behavior within the College of Health and Human Performance at the University of Florida. I am also the Associate Director of Teaching and Practice for UF Mindfulness, and I have been practicing and teaching mindfulness in the form of yoga and meditation for 23 years now. In our time together today, we'll first talk about mindfulness and the body scan as a mindfulness practice. We'll discuss the body scan as a tool for pain management. And finally, I'll guide you through a short body scan practice so that you can experience it for yourself. Since the term mindfulness is quite common these days and it's used in a variety of ways, I would like to offer a definition for the purpose of this session. Jon Kabat-Zinn is largely credited for bringing a mindfulness therapy program called mindfulness-based stress reduction to modern medicine. I borrow his definition for mindfulness as shown here. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So mindfulness is a way of being that requires the skill of keeping sensation, emotions, and thoughts in moment-to-moment awareness without judgment. And to hone a skill, we must practice. So mindfulness practices such as the body scan help us to hone our ability to be present and accepting, which helps us cultivate healthy relationships with our inner world, such as thoughts, feelings, and sensations, including pain, and our outer world, such as friends, family, acquaintances, and our environment. There are many mindfulness practices out there, and we are exploring the body scan today as a practice for two main reasons. One, research shows evidence of its helpfulness in patients with pain. For example, a research study with 63 rheumatoid arthritis patients found that after 2 months of mindfulness training, subjects reported feeling significantly better, even though their physical symptoms did not necessarily disappear. The practice of the body scan in particular has shown effective in reducing pain-related distress and perceptions of both acute and chronic pain. And the second reason we are exploring the body scan is that it's accessible. It can easily be done anywhere, anytime. You don't need any special equipment, and once you're familiar with the practice, you can guide yourself through the process. So the body scan itself is quite simple. It involves scanning the body with your awareness. The goal of the practice is not to look for something or change anything about the body, but rather to simply notice and experience your body as it is in the present moment, one body part or area at a time. It's like taking a tour of your body with childlike curiosity. The practice is typically done lying down on the back with the eyes closed, but it can be done in any position that's comfortable for you. While the body rests in stillness, you move your awareness through the body and meet what you find in the body with friendliness. And friendliness requires acceptance and openness to what you find as you explore. I'll add here that the body scan is different from other guided practices you may have tried, such as guided visualization or progressive muscle relaxation. We are not imagining with our mind, nor are we physically moving the body in this practice. We are also not trying to relax or release tension or pain. However, relaxation often does occur as a result of this practice. But the focus of the practice itself is simply being with the sensations of the body as they are, being in the body and with the body with full awareness. The body scan is a relational practice. It provides an opportunity to be with your body in an open, accepting, and friendly way. For many, this is a radical idea, especially if you live in a body with pain, which we all do at some point. By systematically and intentionally resting our awareness on each part of the body, one part at a time, while withholding judgment of our experience, we open space to experience sensations of the body in a different way. By consciously choosing to drop the thoughts that judge and resist the pain, we can find ourselves with less pain to manage. The physical pain may still be there, but the pain and stress that comes from resisting the sensations can resolve and bring a greater sense of well-being. With improved mental and emotional states, perception of the pain often decreases. And finally, but certainly not least, this practice focuses on the whole body, not just those areas in pain. Pain's job is to make us aware of something so that we can take action to address the pain. And this is a good thing. However, when the pain becomes chronic, this can become overwhelming and it can feel like the entire body is in pain. Areas of the body that are not in pain often go unnoticed when pain is present elsewhere. This practice provides an opportunity to become aware of the parts of the body that aren't in pain. Not only is it refreshing to allow your awareness to rest in these areas, it also provides a potential coping mechanism for pain. Through this practice, and over time, you may discover certain areas of the body that are not in pain and are easy to feel into. You can use these points in the body as resting points for your awareness to give your mind a break from the pain when needed. Now, let's take the time to experience the practice itself. I will offer a short guided body scan, which will last around 15 minutes. And in a moment, I'll pause for 1 minute to give you time to set up. But first, let me offer a bit of guidance on how to set up. As I mentioned earlier, this practice is typically done lying down on your back. If lying down on the back is not a comfortable option for you, then please take the time to find a comfortable seat or other position, perhaps lying on your side. Feel free to get a blanket or pillow or both, or switch to a different chair if needed. And this practice is easiest in a quiet, calm environment without distractions. I also recommend turning off overhead lights. And finally, you will not need to see the screen for this portion of the session. However, do make sure that you keep your device close enough so that you can hear me well. I'm now going to pause for 1 minute to give you time to get comfortable and settled. If you need longer than 1 minute to set up your space, please pause this recording and restart when you're ready. Okay, I hope that you have found a comfortable, quiet space to be for this practice. If not, again, you can pause and finish setting up as needed. We will first start with the breath and then move into the body scan. So gently bring your awareness to your breath in the belly. And as you breathe in, just simply be aware that you're breathing in. And as you breathe out, be aware that you're breathing out. This is a moment-to-moment awareness of your breathing. Feel your belly rise on the inhale and fall on the exhale. And just notice this breathing in and breathing out. Mindful of the belly's expansion and contraction, one breath at a time. If you notice that your mind begins to wander, going into future or past, or following thoughts, memories, or dreams, just gently acknowledge to yourself that your mind has wandered. Notice where your mind wandered to, and then gently bring yourself back to the breath. And again, follow the breath in and out, noticing the expansion and contraction of the belly. And now begin to draw your attention away from the breath and to the body as a whole. In doing this practice, please pay attention to what it is that you're experiencing, the sensations. Sensations can be variable, ranging from aches and pains to itchiness to tension to deep feelings of relaxation. From hot to cool, wet to dry, heavy to light. These can all be sensations that you experience as you begin the body scan. Whatever it is you're feeling, just simply acknowledge what's there. Aware from moment to moment. There's no need to make anything come or go away. This practice is a simple noticing of your experience. For example, if you notice tension as you move through the body scan, just allow yourself to settle into the experience of tension, noticing what your muscles feel like when they're tense. Be aware of the sensation of tension and notice what happens next. There's no need to either make it come or go. Now gently bring your awareness to both feet. Be aware of the sensations in the soles of your feet, toes, tops of your feet, and ankles. Focus all attention on your feet. And now gently shift your awareness from your feet to the lower part of your legs. Notice the calves and shins. Notice your knees. And just simply be aware of what you experience through this area. Allow yourself the simple sensations of skin and muscle. And now gently scan upward to your upper legs, noticing the muscles of your thighs, noticing the skin, perhaps even feeling the bones. Just pay attention to sensations that you experience moment to moment. And now take a deep breath in. And as you exhale, shift your attention to your hips, buttocks, and pelvis. And notice the sensation. Paying attention, being mindful, aware of what you experience through the hips, buttocks, and pelvis. And now gently leave this area and focus your attention, place your awareness on your lower back. Feel the curve of your low back, and then slowly move upward, noticing the muscles of your back, aware of your spine. Notice the ribs. And slowly continue to move up the spine to the area between your shoulder blades. Paying attention as you scan your back. Notice any sensations that arise. And then take a deep breath here. Notice the movement of the upper back as you breathe. And now gently shift your attention from your back. With an inhale, place your attention on your abdomen. And on the exhale, let your attention settle in the belly. And notice the sensations that arise as you focus your attention in the space between the abdomen and mid to lower back. If you find your mind wandering away from the body part you're focusing on, just again remind yourself to return, acknowledging that your mind can go off into different places, but you can always gently bring it back. And in this moment, notice that you're focusing on the area of your body, the abdominal cavity, that houses many organs. And now with an inhale, let go of the abdomen. And on the exhale, gently focus your attention on the chest. Be aware of the space underneath the rib cage. Notice your heart. Notice the muscles of the chest itself. Just gently scan around and through this area, aware of this part of your body and the sensations present here. And now shift your attention to both hands. Starting at the tips of your fingers, gently begin to scan your hands, aware of sensations you experience in and around your fingers, backs of your hands, palms of your hands. Just notice what you feel. And gently move upward to experience your wrist, noticing your wrist joints. And then to the lower arms. Paying attention also to your elbows. And shifting your attention to your upper arms. And now notice your shoulders as well. Pause for a moment here to notice the whole of both arms. And now with an inhale, let go of your arms. And as you exhale, shift your attention to your neck and throat. Notice what it is that you experience here. And then slowly scan upwards, allowing yourself to feel the sensations in the head, the skull. Begin to scan around your head, moving up the back of the skull, top of the head, down to the ears, and then over to the face. Take a moment here to simply notice your face. And now gently scan upwards from the face to the very top of your head. Noticing your head, your hair, any sensations you experience right at the top of your scalp. And with your next inhale, gently leave awareness of your scalp. And as you exhale, allow your awareness to expand out to the entire body. And pause to simply notice the body as a whole. Feel the body moving with the breath, the gentle expansion on the inhale, and the release that comes with the exhale. And take a moment now following your breath, paying attention to the in and out of your breathing. And now shift your attention to your skin. Notice the sensations there. Temperature of the air, any textures against the skin. And with an inhale, move away from the skin, and as you exhale, focus on the ears. Take a moment to notice the sounds in the room and sounds outside of the room. With your next inhale, move away from the ears, and as you exhale, become aware of your eyes. Feel your eyes beneath the eyelids. Take an inhale here and wait for your exhale to gently open the eyes and allow the sights of the room to enter into your awareness. Pause in stillness to simply notice the images coming in. And as you do so, notice how you feel in this moment. So I'll give you a moment to make your way back to where you can see the screen. So I thank you so much for listening and for trying a new self-care practice. I hope you'll return to this recording and practice again. I encourage you to practice regularly. A regular practice will help you strengthen your mindfulness muscle, so to speak. And while we may not yet know enough to recommend a certain dose as we do with prescriptions, all current evidence points to the fact that the more you practice, the greater the benefits. I also recommend identifying a best time for you to practice if this is a practice that you'd like to take on. So for some, practicing at the same time of the day can support a regular practice, such as before you get out of bed in the morning or as part of your bedtime routine. But I encourage you to consider your reality in terms of your schedule and your pain, if the level of pain varies depending upon the time of day. If that's true for you and you're a beginner to this practice, I recommend practicing at a time of day when you have less pain to start. Keeping a journal can also be quite helpful. Doing so gives you the opportunity to reflect and see how this practice affects you and your body. So journaling about your experience can also offer insights into the patterns of your body and mind, so you can make more informed choices about how to best support your health and well-being. The guided practice you just experienced today was around 15 minutes in length. And that's a relatively short session for body scans. If you'd like to try a little longer session, I link a 30-minute guided body scan below on the web page here. And also, if you'd like to get in touch, please do. I'm happy to answer any questions or help in any way I can. And you'll find my website linked on the page below as well. And finally, here are my citations for research that I briefly summarized in this talk, should you like to take a deeper dive and explore the scientific side of this practice. You can find a PDF with slides for this talk, again, linked on the web page. And I wish you well, and may your relationship to your body and all of its sensations be a friendly one. Take good care.